After the age of 30, your body starts producing less growth hormone. Every decade after that, it drops further. By the time you're 50 or 60, you may be producing a fraction of what you made in your 20s. And growth hormone isn't just about growth, it's about recovery, body composition, sleep quality, skin, healing, and how you feel when you wake up in the morning. So what if there was a way to signal your own body production to make its own growth hormone? Not synthetic, not from the outside, your own. That's what we're talking about today. The CJC 1295 and ipamorelin, two peptides that work together to support your body's natural growth hormone production. I'm Dr. Myra Reed. I'm a functional and internal medicine specialist with over 35 years of experience. I detect early detection longevity medicine. I help people find what others miss before symptoms become disease. Everything I do runs through 4 pillars: hormones, gut, lifestyle, environment. This is week 5 of my peptide series. We've covered peptide foundations, healing peptides, GLP-1s and muscle loss, and the mitochondrial peptides and fatigue. Today is the episode the entire series has been building towards. Let me show you something. This is what growth hormone production looks like over a lifetime. It peaks in your teens and 20s, then it starts dropping in your 30s. It starts declining, and by your 40s and 50s, the decline accelerates. Some research suggests that growth hormone production decreases by about 14% per decade after age 30. And here's what that looks like in real life. You don't recover from workouts the way you used to. Your body composition shifts, more fat, less muscle. Even if your habits haven't changed, your sleep feels less restorative, your skin changes, injuries take longer to heal. Does this sound familiar? Most people are told this is just aging, and yes, some of it is. How much of it would we ask and accept as normal aging? Maybe it's addressable, because growth hormone doesn't just disappear. The machinery is still there. Your pituitary gland still has the ability to produce it. The signal just gets weaker. And that's exactly where these peptides come in. Now, before I go further, I need to make an important distinction, because when people hear growth hormone, many immediately think of synthetic GHG, that human growth hormone with injections. This is not what we're talking about today. Synthetic HGH is growth hormone from the outside. You're injecting the hormone itself, and when you do that to your body recognizes that growth hormone levels are high. So it does what any smart system does. It reduces its own production. You're essentially replacing your body's function rather than supporting it. Secretagogues are completely different. CJC 1295 and ipamorelin don't add growth hormone to your system. They signal your pituitary gland to release more of its own. Your body stays in control. The feedback loops stay intact. One shuts down your natural production. The other that we're talking about here today, that's the difference. And this is an important one. So let's break this down again. Starting with CJC 1295. CJC 1295 is a growth hormone releasing hormone analog. In simple terms, your brain naturally produces a signal called GHRH, growth hormone releasing hormone, that tells your pituitary gland to release growth hormone. CJC 1295 mimics that signal. What makes CJC 1295 unique is that it has a longer half-life than your body's natural production of GHRH. Your natural signal is very short-lived. It fires and disappears in minutes. CJC 1295 extends that window, which means a more sustained release of growth hormone over time. People discuss CJC 1295 for its potential to support body composition, recovery from training, working out, sleep quality, and overall vitality. Some research suggests that it may help support fat metabolism and lean mass preservation. Now here's the important thing. CJC 1295 amplifies the signal, but it's most effective when it has something to work with. which brings us to ipamorelin. Ipamorelin works through a different pathway. It's a ghrelin receptor agonist. Now, ghrelin is the hormone most people know as the hunger hormone, but ghrelin receptors are also involved in growth hormone release. Ipamorelin stimulates growth hormone release through the ghrelin pathway, and it does it so it's in a pulsatile fashion, meaning it mimics the natural rhythm of how your body releases growth hormone. It's not a constant flood, it pulses. Your way that your body was designed to do is to pulse. What makes ipamorelin particularly interesting is its selectivity. Unlike some older growth hormone secretagogues, ipamorelin has a cleaner profile. It doesn't significantly raise cortisol or prolactin, which are common concerns with other peptides in this category. So when you combine CJC 1295 and ipamorelin, you get two complementary mechanisms working together. The CJC 1295 extends the release window, ipamorelin as the pulsatile trigger, and together research suggests they support a more robust and natural pattern of growth hormone release. That's why clinicians often pair them. Think of it this way: CJC 1295 is the amplifier, ipamorelin is the trigger. Together, they're louder and more rhythmic than either one alone. Now, CJC 1295 and ipamorelin are the gold standard combination, but in clinical practice, we don't just pick one peptide and hope for the best, we stack them. We combine them strategically based on the patient's goals. Tesamorelin is an FDA approved for specific conditions, reducing excess abdominal fat in the HIV patients with lipodystrophy. It's a growth hormone releasing hormone analog similar to CJC 1295, and some clinicians are interested in its potential beyond that indication. It's one of the few peptides in this category with actual FDA approval for clinical use. Samorelin was one of the earliest growth hormone secretagogues used clinically. It's a truncated form of a natural growth hormone releasing hormone. It has a shorter half-life than CJC 1295, which means it's more frequent dosing, but it has a longer track record of clinical use. Now, here's the important thing. These peptides are rarely used alone. For the highest clinical yield, they're stacked, combining to amplify your body's natural growth hormone pulses. For performance and longevity, the most common protocol is CJC 1295 combined with ipamorelin. This is the gold standard for improving sleep quality, recovery between workouts, and body composition. It's typically administered at bedtime to align with your body's natural circadian growth hormone release. For aggressive fat loss, particularly stubborn visceral belly fat, tesamorelin combined with ipamorelin. Tesamorelin is specifically recognized for its ability to reduce visceral adipose tissue, that fat tissue here. When combined with ipamorelin, you get the fat metabolism benefit plus the growth hormone pulse support. And for those seeking a gentler approach, samorelin. It's a milder option with a lower side effect profile, often used for patients focusing on vitality, lean muscle, and overall wellness. The right combination depends on the individual, their goals, their health picture, and what we find when we look at everything together. That's the point. It isn't a one-size-fits-all. It's personalized. So who is actually a good candidate for growth hormone peptide support? And just as importantly, who isn't? In my practice, I don't just start with peptides. I start with the foundations: sleep, protein, resistance training, stress management, hormone optimization, gut health, because peptides are tools. They're not magic, and they work best when the foundation is already in place. That said, the patients that I consider for growth hormone peptide support are typically people who are doing the foundational work, but they're still just not seeing that recovery that they want, or their body composition exactly how they want, or the vitality that they should expect. Things like unexpected muscle loss, fight training, or poor recovery that doesn't match their effort, body composition changes that just resist lifestyle interventions, and significant fatigue that we've already addressed from the other angles. Sleep that's not optimized, but it's just not restorative. And then there are people who are not candidates because these peptides stimulate the growth hormone pathway. You must screen for cancer risk before starting. They are generally contraindicated in patients with active malignancy or pre-existing tumors, people with uncontrolled diabetes, certain pituitary conditions. Common mild side effects can include things like the injection site irritation, water retention, occasional headaches. This is exactly why medical supervision matters. These are not supplements you order online and figure it out yourself. Don't let your first symptom be your last, and in this case, don't let the wrong provider be your last consultation. This needs to be done right with proper evaluation, proper monitoring, and proper follow-up. If you've been watching this series from the beginning, you've seen a pattern. Week 1, we talked about what peptides are. Week 2, we talked about healing. Week 3, the GLP-1s and why muscle matters more than the scale. And week 4, mitochondria and fatigue. And today, growth hormone and recovery. Every one of these videos comes back to the same thing. Your body has incredible systems for healing, energy, cognition, and recovery. Sometimes those systems need support. And the question isn't whether to support them, it's how to do it intelligently, safely, and with the full picture in mind. That's what early detection longevity medicine is about. It's not about waiting for disease. It's not about treating symptoms after the damage is done. It's looking at everything: hormones, gut, lifestyle, environment, and intervening early. If this series has been helpful, subscribe and turn on those notifications because I have a lot more coming on hormones and longevity and what your body might be trying to tell you. If you missed any of the earlier weeks on videos on peptide foundations, the healing peptides, GLP-1s, mitochondrial energy peptides, the full playlist is linked right here. And if you want to work with a physician who looks at the full picture, not just one number, not just one symptom, but everything, take my free assessment. It's there, the link is in the description. Everything I do, every protocol, every patient, every video runs through one belief. I'm Dr. Myra Reed, helping you to live smarter, stronger, longer. Don't let your first symptom be your last.